Who should not take Tylenol? You should not take Tylenol if you are allergic to acetaminophen, or if you have severe liver disease. Do not take this medicine without a doctor's advice if you have ever had alcoholic liver disease, cirrhosis, or if you drink more than 3 alcoholic beverages per day, you may not be able to take Tylenol. Besides, Tylenol has also been known to cause heart problems, so make sure to consult your doctor. What are the side effects of Tylenol? The most common mild side effect of Tylenol is nausea, which occurs in about 40% of patients. Other side effects are red, peeling or blistering skin, rash, hives, itching, swelling of the face, throat, tongue, lips, eyes, hands, feet, ankles, or lower legs, hoarseness, difficulty breathing or swallowing. Is it harmful to take Tylenol every day? No. Most people can safely take Tylenol within recommended doses every day. What organs can Tylenol damage? Tylenol is a common OTC pain reliever and fever reducer. But it does carry a risk of liver damage. Tylenol-related liver damage happens most when a person takes too much. When liver damage or failure happens, it's not always reversible and can be fatal. Taking too much acetaminophen can damage the liver, sometimes leading to a liver transplant or death. The body breaks down most of the acetaminophen in a normal dose and eliminates it in the urine. But some of the drug is converted into a byproduct that is toxic to the liver. Does Tylenol damage kidneys? Acetaminophen is one of the most common analgesic medications available over the counter. Acetaminophen overdose can cause both hepatic and renal injuries. The literature suggests the incidence of acute kidney injury is around 2% to 10% in those with acetaminophen overdose. Does Tylenol raise blood pressure? Regular acetaminophen use increases both systolic and diastolic blood pressure in individuals with hypertension, with an effect similar to that of nonsteroidal anti-inflammatories. This rise in blood pressure is seen both in those taking and not taking any hypertensive therapy. Can Tylenol cause heart issues? Over-the-counter pain relievers, Tylenol, acetaminophen, and nonsteroidal anti-inflammatory drugs, NSAIDs, such as Motrin, Advil, ibuprofen, and Aleve, naproxen sodium, can increase blood pressure and cause irregular heart rhythms. It is linked to an increased risk of heart disease and stroke when used long-term. Can I take Tylenol with blood pressure medicine? You can take Tylenol with blood pressure medication. This is because the active ingredient in Tylenol is acetaminophen. This is a different type of painkiller than NSAIDs, and it does not raise blood pressure. Can Tylenol calm your nerves? Tylenol can indeed alleviate anxiety. The scientists speculate that anxiety, like emotional pain, is interpreted as a type of pain by the brain. Does Tylenol reduce depression? For example, one experiment found that people who took acetaminophen were less emotionally distressed while reading about a person suffering physical or emotional pain and felt less regard for the person, compared with people who did not take acetaminophen. Is it okay to take Tylenol every day for arthritis? Can I take Tylenol arthritis every day? Yes, but you should be cautious. Acetaminophen, the main ingredient in Tylenol arthritis, can cause liver damage if taken in large doses. Does Tylenol interact with any medications? There are 109 drugs known to interact with Tylenol, acetaminophen, along with 3 disease interactions, and 1 alcohol, food interaction. Of the total drug interactions, 7 are major, 67 are moderate, and 35 are minor. Is Panadol similar to Tylenol? Acetaminophen, Tylenol, and paracetamol, Panadol, are the same pain-relieving medication. In the US and Japan, it is called acetaminophen and paracetamol in Europe and most of the rest of the world. Acetaminophen, Tylenol, and paracetamol, Panadol, are the same medication. Please like this video and subscribe to our channel.